I'm Joseph Tapper with Dr. Janice Tapper. This is Better Health with X39. Let's get patched. All right, Joseph Tapper here, back with Better Health X39. How you doing, Dr. Tapper?
Fine. How are you today?
Oh, good.
Wonderful.
Today we're going to look at a testimonial about Alzheimer's. This is incredible. There's so many people affected. One thing I want to ask before we get into the video, what's the relationship between Alzheimer's and dementia?
Well, people get dementia first, and long-standing dementia turns into Alzheimer's, and that's over a period of time. So you can get, like I said, dementia, and over a period of time, it turns into Alzheimer's. After several years, it's diagnosed as such.
Okay.
Good evening, everyone. Thank you so much, Verdita, for inviting me on this meeting and to give my testimony. I'm going to give a little background. My name is Ramona Holmes. I am a retired RN with 41 years of service. I was introduced, my husband and I, to the X39 patch, probably the latter part of January, by our good friend Benita, who is now our sponsor, who brought this patch to us. And me being a skeptic as I am and everything, but my husband was all on board. We were introduced, like I said, in January. After 2 days, my husband was like that 1 or 2 day wonder. He became able to sleep longer hours. He had no pain in his knees that he had been dealing with for a while. And he had a lot of energy every single day since he took the patch. Now, myself, it took me about a good 4 or 5 days before I started experiencing better sleeping, more energy, and also feeling like I was resting better at night. Okay. Now, going back some time and everything, I had my knees both replaced about a year ago. But still, anybody who's been on this call that had knee replacement, you know that isn't the end of it. You're still stiff in the morning, still having to stretch in the morning. Well, after taking the patch and being on the patch for about 2 weeks, I had no more stiffness in my knees. I ended up having all of this energy every day. And also in everything, I was experiencing where I have no pain anywhere in my knees. Also, I deal with what is told to me as being a rheumatoid type of diagnosis of scleroderma. Any of those who know what that is, it is stiffness and tightness and excruciating pain in your hands, even in your face, where that you are not able to even make a fist, which I was not even able to do this at one point. I put that patch on my hand, and I'm telling you right now, I had no more pain. The stiffness is even decreasing in my hands and all after having such excruciating pain. Also, this is my biggest testimony is about my brother, who is 73 years old, and about 8 years ago, he was diagnosed with dementia and has now advanced to Alzheimer's. My brother has been declining in health in the past year, where he's in bed all day long, not wanting to get up, getting agitating, fighting with his wife and his daughter about getting up, has been developing blood clots, urinary tract infections, the whole bit, not wanting to eat. I mean, horrible. After 3 weeks of being on the patch, my brother is up getting busy, getting out of bed, getting into stuff, getting into trouble, and talking, looking at TV, eating better. Appetite is increased, using the restroom. He was even on diapers at one point. He's able to use the restroom now. I'm telling you right now, his wife was thinking he was getting worse. I said, no, I think his brain is waking up. I am so on fire about the X39. I mean, this is my jam, okay? That is my testimony, and I'm sticking to.
Wow, there was a lot going on there. It wasn't
Yeah.
just Alzheimer's.
Right. Quite amazing. I'm glad her entire family has gotten some results from this X39 patch.
Yeah,
Wonderful.
they did. Let's see, what was some of the other things before we get to Alzheimer's?
Yeah, well, she spoke of having bilateral knee surgery and having decreased pain, where actually she hadn't had any pain since she's been using the X39 patch. Prior to, she had to get up in the morning and do stretching and things to help basically get her day started.
Get those knees. She had knee
Yes,
replacements.
yes.
So She said they were stiff when she got up
Correct.
in the morning.
Correct. She also was fighting with scleroderma. And what happens with scleroderma, you have a stiffness of your connective tissue that helps us pretty much be mobile like this. She had difficulty closing her fist. She indicated that she had some tightness in her face. That's because of the connective tissue in our body. It just stiffens and you're not able, it's not as mobile and flexible as it usually is. So she also got some relief from that. Because I'm sure with the pain in her knees, then she can't move her joints, and it was quite debilitating for her. She indicated that her physician said that she was might have rheumatoid arthritis, but she described it as more of a scleroderma, like I said, which is stiffening of your connective tissue.
And then her husband got almost immediate results.
Yes.
He got better sleep almost instantly.
Yeah.
He started doing good too.
Yeah, but what was so amazing when she spoke of her brother, indicated that he was 71 years old or is 71 years old, and he's started out with dementia, and as dementia advances, it turns into Alzheimer's. So he was just being non-compliant. They do get agitated, not wanting to eat. He was having some urinary incontinence where he was not able to go to the bathroom on his own. He was using some adult briefs and just fighting with his family, not wanting to get up, not wanting to do anything. So once he started wearing the X39 patch, it just turned his whole universe around. He became more compliant. He was going to the bathroom on his own. He began to eat. She said he sat and watched TV. He got his life back, quality of life, I would say, being able to be there for his family.
She even said he started getting into trouble.
Yeah, getting into trouble. Yeah, that was funny about that. She didn't go elaborate on what kind of trouble he was getting into, but he was a human being. He was a person again and living his life. That was wonderful.
Yeah, that's amazing. Now, Dr. Tapper, it makes sense that if Alzheimer's and dementia, if they found relief wearing the X39 patch, shouldn't men that don't have that, shouldn't they wear it just as a preventative? Would that make sense?
Well, dementia, Alzheimer's, as I indicated in previous discussions, it comes from chronic inflammation. So when you ask about should men wear it, I think everybody should wear X39 patch to take care of it, whatever your situation may be. It repairs our body and heals us. So regardless of what type of condition you have, the X39 patch is going to help.
Well, it makes sense to me that I know a lot of my friends have mentioned that they worry about dementia. And so it makes sense to me as a preventative measure to go ahead and start wearing it now. If you're concerned about that, then start early.
Yeah, the unfortunate thing is we don't know who's going to get dementia. It's not one like high blood pressure or diabetes that we're looking at numbers over a period of time and you have risk factors, but there are risk factors. It's just something that needs to be monitored. When you see changes in your family mentation, your family members' mentation and stuff. But as Joseph indicated, why not patch early? Put that X39 patch on as a preventative, and hopefully you get some good results from that.
Because once you reach the age of 30, 50% of your stem cells become dormant. Once you reach the age of 60, 90% of your stem cells become dormant. So
that's basically like you don't have any stem cells.
Right.
They're there, but they're lying dormant. So what this patch does is wake those stem cells up and get them to working for you.
And it's better to work with all of your stem cells than just 10%.
Correct.
That's going to prevent a lot of, I think, issues, illnesses, sicknesses.
Yeah.
Because your stem cells are there to repair your system, to repair your body and keep your body well. Just makes sense. I've had people ask me, Dr. Tapper, well, do I have to wear it the rest of my life? I know people that are taking a lot of vitamins and they're going to do it the rest of their lives because they want to keep their body functioning at an optimal level. Yeah. Well, it's the same thing with this. If you want your body to function at an optimal level, then why not do it the rest of your life?
I agree. It's not going to hurt you. There's no medications in the patch. There's no risk of side effects. So why wouldn't you want to do something? If it's working for you, continue it. I had gone to a conference not long ago, a primary care conference, and we were talking about that exact same subject, about for example, one of the physicians spoke of him treating the person with high blood pressure, and then the next thing you know, the person has some side effects, and so there was another pill, and then there's another pill, and if that pill is not working, then we tweak and switch it up, and you might need a different type of medication. But with this stem cell patch, it's there for you. It's activating your own stem cells. Your body is healing itself.
That's true. That's true. And I've never, maybe you have in your practice, but I've never confronted a doctor that told me to take this medication until you're cured.
Yeah.
Take it the rest of your life is what they say.
Yeah. In certain situations, you
Yeah.
definitely have to take a medication for the rest of your life. Just think of a person who had a blood cancer and have stem cell transplant, and to avoid rejection because of the low immune system, they have to be on anti-rejection medications for the rest of their life. So which one you want to wear, the stem cell patch or taking 6 and 7 pills a day for the rest of your life, or even more?
Now, how does the stem cell activation patch compare with stem cell transplant?
Well, that's a whole different area. Stem cell transplant is given to those people who have blood cancers. The stem cell patch, I don't believe there's a lot of research on cancer treatment and what it will do if a person had cancer that could use it. So I cannot elaborate much on that because there's no research, at least that I know of, that hasn't been done on treating cancer. Maybe the symptoms of cancer when people have chemotherapy, the nausea, vomiting, diarrhea, pain that they experience from their chemotherapy and having stem cell transplant. Yes, I agree that the patch will be able to help those symptoms, but to treat or cure a cancer, I cannot elaborate on that.
Now, what about the stem cell injections? I've heard of people getting injections in their knees or
Yeah.
joints, things like that.
Yeah.
How does that compare to the patch?
Well, again, the stem cell injections, one, they're very costly. It's painful when you're being injected with it. It's basically given to someone who, like in their back or knee, who have pain, to decrease inflammation. But again, it's readily available, but who can afford $3,000 to $10,000 a month or whenever you need an injection to pay for that? It's quite expensive. You can wear the stem cell patch. You're not being injected. There's no needles. There's no pain with the patch. It's can be worn without any pain, no side effects, no risk factors. There's no medication in it. Again, it's your body healing itself. The stem cells that are being injected into your body, whose stem cells are those? They're not yours, so there's a risk of you having some type of side effect or allergic reaction or quite a few other things that could happen.
Makes sense to me. Get patched.
Get patched today, and don't ask the question, should I wear this for the rest of my life? Think of being healthy. It's helping you. Don't even ask the question. Don't think about it. There's no medication in it, no side effects. Wear the patch.
And you don't need a prescription.
And you don't need a
Not
prescription, correct. And it's not one that needs to be approved by the FDA, Federal Drug and Administration, because there's no food, there's no drugs, and it's patented, and it works. Lots of testimonials out there, and the patch works. It's amazing. It's nothing more than extraordinary.
Say patented.
It is patented.
Okay. All right. That's it for today. We'll come back next time with another video and chop it up.
Thank you. Thanks for being here. We'll see you soon.
Have a great day.
Have a good one.
Thanks for watching. Please like and subscribe. Tick that bell. We'll let you know when the next video is coming.